I have to switch the biblical question for this week. I have a brand new biblical question today. And that question it is, which do you prefer, to save lives or to save the economy? Which do you prefer, to save lives or to save the economy? Brand new biblical question. And I'll tell you why as we move forward. Lots of talk about the Chinese virus. Lots of talk about it. I have with me Dr. Mark Bruce. He is a Wisconsin-based emergency medicine physician. He works in infectious diseases. He has worked in Central America, Europe, and was in Asia during the SARS outbreak. Dr. Bruce, thank you for coming on.
You're welcome, Jesse. Good to be with you.
Thank you very much. I want to try to get some clear and simple answers about the Chinese virus. So I really appreciate you coming on. First, people want to know, are we all going to die?
No, this isn't a death sentence. As a matter of fact, currently, out of everybody that's being tested, more than 90% of people in the United States and more than 96% of people in South Korea are testing negative for this virus, which means that even if you have symptoms, those people are testing negative. Those that are testing positive, probably we think that the mortality rate in the United States is going to land anywhere between 1% to 2%, which means that 99 to 98% of people that do get infected with this virus are going to do just fine.
Amazing. This new medicine that they're talking about, possibly testing, do you know if that will work or not?
Well, there's Jesse, you know, the whole concept behind medical science is totally data driven. And since this is a novel virus, which means new, you know, prior to 4 months ago, we didn't even know that this existed, or it didn't exist prior to that time, that we are scrambling every day to try and get more data on this virus. And what we've seen so far is that, yes, there are some reported effective treatments, specifically a malaria drug by the name of chloroquine or hydroxychloroquine under the brand name of Plaquenil, which has been well known for 70, 80 years, in combination with either azithromycin, which is an antibiotic that many people have taken before, and or also an AIDS drug by the name of remdesivir. So we have a lot of hope in terms of treatment that is, we think, going to be more widely available. But we need to get more data to know, first of all, who gets the drug, when do they get the drug, how long did they get the drug or the drug combinations, for what period of time. So those are all of those type of decisions are data driven, particularly in light of the fact that all of these medications can have substantial side effects.
And a lot of people, a lot of people are afraid. They don't trust the government. And so they think that this whole virus thing is, and then this new medication that they're coming up with is part of the government takeover. And people don't trust medications from the government anymore. I remember when they were saying that, I believe it was a flu shot or something that they wanted people to take at the drugstores or anywhere. A lot of Americans, including myself, refused to take it. How should people feel about this drug coming up, that they're trying to come up for this virus now?
Well, Jesse, you know, I think that people are going to believe what they want to believe. But again, when you look at this from as objective a perspective as you can, and, you know, I'll tell you that all of us have bias. I think that it's really important that we recognize what our biases are and apply that as best we can with the minds that God has given us to the whole scientific evidence that we have. Again, the data that is available. I will tell you that I am very suspicious out of a lot of the data that we're receiving from China, because China has significant constraints on both medicine and science, and they do that for political purposes. I think that that is much less of an issue with our government and with the Western governments. I think they are much more transparent and have, just because of the whole governance model that we have in the Western world, than what they do in a communist world. So having said that, I understand that a lot of people have anxiety about this. That anxiety is normal because this is something totally new. And so when you're faced with something totally new that doesn't have an established track record in terms of treatment, that anxiety is very natural.
Yeah. But why is it so? It seemed to be so bad in Italy. Why? What happened over there that it's really affected a lot of folks?
Yeah, that's a great question, and I think that the final answer to that is probably unknown. I can tell you, because I've traveled over there quite a bit,
Right.
that the entire country is a much more densely populated country than what, especially the northern part of the country where this was really got the traction, than what a lot of areas of the United States. Having said that, we know the Dr. Margaret Harris yesterday announced, she's a World Health Organization spokesperson, that 85, as of the increase in new cases on Monday of this week, 85% of those cases came from the Western world. And out of those cases, well, there were 40% that actually came from the United States. But again, the brunt of those increases are occurring in very, very densely populated areas, particularly in New York and New York City out in particular, and also in California, where again, the population density is much greater. So the other aspect of Italy is that they have a socialized healthcare system that does not have the reserve medical resources that many other areas of the world have, particularly areas like South Korea, some areas of Asia, and even the United States. And having said that, we are very concerned that this could easily overwhelm our current healthcare system and resources too. And that's part of the reason why there's been such an emphasis on trying to contain this pandemic before it reaches that point of overwhelming the system. You know, we're busy enough already with dealing with other medical issues, and to divert all of our resources towards treating this viral infection. You know, there's 2,000 people in America today that are going to die of their heart disease. And if all of a sudden, all the resources that we would normally have in terms of ICU beds and medications, personnel resources, all those things are diverted to treating a viral infection, you can imagine what's going to happen with that kind of mortality rate with all these other chronic diseases, not to mention people that have complications related to their diabetes and other infectious issues, and down the list it goes.
Amazing. Should the rest of the country prepare for what New York is dealing with now?
Well, they should, and I'll give you a good example of that, Jesse. There's simple math that we can apply to this. We know that, again, from our own country's experience and also other countries' experience, that one person who has COVID-19 will typically infect 3 other people unless this is contained. So if you do the simple math on that, in 14 days, that one person, if this goes unchecked, will potentially infect 4.7 million people.
That's amazing. So if you're not having any symptoms, you don't feel sick, you're not sick, and but you could have it and not. What should a person do? I mean, should they self quarantine, or if they don't have it, they don't feel sick, they're doing well, they're in good health condition, should that person stay home?
I don't think so, Jesse. I think that many times there can be an overreaction that is sometimes worse than the disease itself.
Right.
And, I think I heard at the beginning of this segment here, you talking about do you save lives or do you save the economy?
Right.
And I think that our government is really trying to find the balance between that. I don't think it has to be one or the other. And I think that they're trying to find the balance. But I'll tell you that my advice to patients, especially younger patients, is that we realize that there is a defined at-risk, very vulnerable population. And that is an older population, especially older population of people that have chronic disease. Having said that, we know that there's a lot of people that are younger and have no risk that can still be very, very affected by this and even die. Now, we look at the Italian statistics, and there was 1% of people that died that were young and did not have chronic disease. So this is one aspect of this disease that we're trying to figure out is why does that happen? And that probably has to do something with that individual patient and the way that they manufacture or allow that RNA virus to replicate itself. Maybe there's host factors that really have a profound impact on that. And they may have had perhaps another cold or some type of illness that knocked down their own immune response and allowed this to overwhelm them.
Yeah,
So what I tell patients, I'm sorry to interrupt you and step on you there, Jesse, but what I tell patients is you do the things that are prudent precautions. You wash your hands a lot. You cover your mouth when you cough. You clean surfaces, if you've been coughing or sneezing around something. You keep yourself well hydrated. You get good rest. You kind of do all the things that your mother told you to do whenever you got a cold.
right. We should already be doing those things anyway. Washing our hands, putting our hands over the mouth when you cough, and all those things. One thing that is happening in America is that you have the liberal media, the Democrats, and others who hate the president. And so whenever he says something, or when they mention this virus, they blame it on him. Or like the other day, he said that he hoped to be back or come back to work around Easter, right? And so now the Democrats and others are saying, no, that's not right. We can't do that. So we're getting a double message, and people don't know what to believe. It seems to be more a political thing than everybody being on one accord about what's really happening. You can't trust the media, and some people who hate the president do not trust him. Do you think isn't that going to cause more confusion about what people should do?
It's really a sad state of affairs, isn't it, Jesse?
Yeah, yes.
Again, it goes back to people are going to believe what they want to believe. And, I've heard it said that if the president cured cancer, that they would take issue with that.
Right.
And so I think that there is such animus, such hatred that is clearly not a biblical or godly perspective in which we are to pray for our leaders.
Yeah.
And we are to respect authority. And we see that just totally cast aside by the groups that you just mentioned.
And it's just crazy because you would think that they would put that aside until all this is taken care of. But the hatred is overwhelming them. They cannot do the right thing. I want to know, I see a lot of people walking around with those mask things on, and it makes it look like they have the disease. Should we be concerned about that?
When I was traveling in Asia during the SARS epidemic back 17, 18 years ago, I'll tell you this story. I saw this panic up close and personal with SARS.
Right.
And everybody, and you still see this even whenever there's not any kind of disease process. Many Asians, whenever they get on an airplane, will put a mask on. The mask does two things. First of all, it does inhibit droplet spread. In other words, the things that are coming out of your mouth, basically it'll catch. And that is a significant vector of transmission for this particular virus, is droplet spread. But it does a second thing, and that is the people that are wearing a mask, it doesn't let you touch your own nose, because that is the second thing that happens, is that you touch a surface that has the virus on it and touch your mouth or your nose, you've just self-inoculated yourself. Having said that, there are a lot of unique characteristics about this virus that make those masks somewhat of limited utility. If you are in a high-risk environment, or you are such as in a crowded waiting room or a crowded space where, we're not supposed to gather with more than 10 people now, but if you find yourself in a situation like that, or you are in the presence of somebody that has substantial vulnerability and risk if they were to get this virus, then in those circumstances, I don't think it's an unreasonable thing to do. But for everybody to go out and get a mask, I think is a little bit on the crazy side.
I agree. I want to take a call for you, but I want to ask, in California and New York, but especially California, there are a lot of homeless people now. They're everywhere. And illegal aliens and others all over the streets. What's going to happen with those folks concerning the coronavirus situation? If they heal the people who are normal, won't the homeless people still have it?
Absolutely. I mean, those are people that, again, bear a significant risk, because many of those homeless people don't have very good health to begin with.
Right.
And they may be having some type of chronic disease or current infection that they may not even know about, because they don't see a doctor. They are not connected to the healthcare system. And so they are a very much at-risk population, both not only for themselves, but for propagating this virus. And like I said a few minutes ago, one person can, in 2 weeks, technically cause 4.7 million infections.
That's amazing. Do you like the way the president is handling this?
I really do. And I like the team that he's surrounded himself with. These are Dr. Fauci is one of my heroes. I mean, this guy is, he's 79 years old. He's still seeing patients. He's a brilliant guy. I think that they are doing, quite frankly, from my perspective as a clinician and knowing a little bit about this virus and having experienced a coronavirus epidemic, not pandemic, but epidemic with SARS, I think that they're doing all the right things.
Amazing. Yeah, I like the way he sounded. I trust the president, so I really like his team as well. I like the way he's dealing with it. In Los Angeles, Mayor Garcetti is moving the homeless people into community centers to protect them from the virus. That's what CBS News is reporting now. One last thing I got to ask, and then we're going to go to the calls. They are telling people to stay at least 6 feet apart from one another. Is that a good idea?
It is, Jesse, and I'll tell you why. The first rule of any epidemic is to protect the uninfected. That's how you contain an epidemic and keep it from becoming a pandemic. And that is how, once a pandemic is present, how you are able to contain the pandemic is by protecting the uninfected. One of the things that we know about this virus is that it's easy to get. It's not as, this will sound kind of crazy to you, but it's not as easy to get as what measles is. The average person that has measles will infect not 3 people, but anywhere between 12 to 18 people. So measles can become epidemic. The nice thing that we have about measles is that there is good herd immunity, which means that enough people have been vaccinated or have had measles that they have the memory. Their body immunologic system has the memory of what this looks like and can manufacture antibiotics against it. We don't have that right now. We don't have that same herd immunity with COVID-19. So, and we know that there's probably this virus can survive in the air for minutes to hours. Some studies have indicated for as long as 3 hours. And so there may be this kind of cloud around somebody and static air that would allow that if you walk through that cloud that's around that person just breathing the virus, there's potential for being infected by that.
That is so weird because we're fighting something that we can't see. And if you can't see it, a lot of times it's hard for people to believe that it exists because they really can't see it.
Exactly.
Mind blowing. I want to go out to Pennsylvania and talk to Ava real fast. Let's see here. Ava, you're on with Dr. Bruce.
Hey, good morning, Jesse. Good morning, Doctor.
Good morning.
How are you?
Good morning, Ava.
I'm actually a nurse, and I work in the nursing homes and the hospitals. And I've noticed that in certain facilities, they've actually been telling the nurses not to wear masks. So I just wanted to get your take on that. I still wear my mask. I just feel safer, like I'm protecting the patient and myself. But some facilities are actually like hiding the sanitizer and the masks from the nurses. So, yeah, could that definitely be a problem? Like, what do you think about that?
Yeah, that does not sound like good policy to me. I mean, you're working in a high-risk environment and around a lot of people that are older and with chronic diseases. I will tell you that my practice in the emergency department is I will routinely, when I first go in to see a patient, I will have at least a surgical mask on. I will not have my N95 mask, which is, fit tested, and a much tighter mask that is much safer for avoiding the aerosolization that we see with any kind of viral illness. But I will wear that loop surgical mask even if I'm going in to see somebody that may have a non-respiratory issue, even like a broken limb or a laceration, something along those lines, because I don't know what that person has been exposed to. And so
Exactly.
I will routinely, I wash my hands going in the room, I wash my hands coming out of the room, and I will have a mask on, again, because both of us are working in those high-risk environments. I think that those are prudent precautions. Having said that, we used to have stacks of masks outside of the doors of every treatment room. We've had to remove those simply for the fact that patients and their families would take the entire stack of masks with them. And so it got us to where we didn't have the necessary resources in terms of that type of thing to protect ourselves and to protect our staff. So we had to remove those. And so, but we have those in strategic locations that are accessible to our staff.
Okay. Yeah, my facility is kind of on lockdown where visitors are no longer allowed. So it's just the residents, the nurses, and the doctors. But at the same time, they still have admission. So
Right.
No one knows what the admissions might have, and no one knows, where the employees were. No one knows who in the employee's house might possibly have been exposed. So
Right.
it's crazy.
Ava,
I would tell you that I don't think that's a very good policy.
Ava, thanks for your call. I appreciate that. It's awful.
Thank you.
All right. What do you think of they're letting prisoners out into the community? And from what I know, prisoners are not affected by this thing so far. Is that a good idea to let them out into the communities again?
No, I don't think so. And again, you want to take the same precautions that you would take in a nursing home in terms of those that are providing the care and support for those prisoners within their confinement, to be sure that they are healthy and that they would not be potentially transmitting the disease to that population. I will tell you that once they do have cases that are recognized in those circumstances, that can be certainly a problematic. But I haven't seen widespread. I haven't seen any case of a prison basically having this type of illness become pandemic or epidemic within that facility. Right. I think it's kind of more of a reaction to, gee, what might happen if somebody does get sick here.
And my final question for you, Doctor, from online, someone want to know, is it true 85% of infected show no symptoms?
It's actually higher. It's probably at least that level. If they do have symptoms, the symptoms that they're going to have are mild to moderate. I mean, they may get sick, but they certainly would not require hospitalization. It would be like a bad cold or a flu if they do get ill. And we know that this has spared a pediatric population almost completely. And so the problem again is that you have grandchildren. Those grandchildren getting around their grandparents can actually be a vector of transmission. They can have it, but can be certainly asymptomatic. But it's not unusual. The challenge with this, Jesse, is that this virus, you can be infected and shedding this virus days to weeks before you do become symptomatic. Whereas SARS and MERS, also both corona epidemics that we've seen in the last 2 decades, you became symptomatic before you started shedding the virus, before you started becoming contagious. So that's the challenge with COVID-19, is that you can have this anywhere between 2 to 37 days. The average is about 5 days before you become infected and start shedding virus. But that's a lot of time that you have before where you could potentially be infecting other people.
Amazing. Dr. Mark Bruce, is there a website, anything you want to give out for the folks?
You know, I think the website that you see on the daily briefings that the president is giving is pretty good. There's and you can link to that, but the cdc.gov website is very good, or the coronavirus.gov website is also excellent and can keep people up to date in terms of what's happening. The information that is posted on those websites lags just a little bit by current reporting.
Amazing. Dr. Mark Bruce, thank you so much for coming on with us. I absolutely appreciate it. Any final advice for everybody?
Jesse, I think all of us need to be on our knees praying about this, that God would protect our country, that God would give our leaders wisdom in this, and that we would be united as a people. And, you know, I've been praying for a revival in this country for a long time, and I don't know if God will use this as a way to spur a revival, but if he does, so be it.
That's right. Well, thank you so much for coming on. I absolutely appreciate it, and we'll talk again.
All right, Jesse.
All right. Dr. Mark Bruce there from Wisconsin. Amazing. Amazing. I got to take a quick break. Back in a moment. Amazing. And don't forget to like, follow, tweet, subscribe, and share the Jesse Lee Peterson radio show, folks. We really appreciate it. We are at war. It is a spiritual battle for the soul of America. And it's going to take all of us to do it.